Hello everyone. Now I want everyone introduce himself firstly, and I will permit everyone to ask any question, and I will answer it. Okay. So excuse me, Dr. Reda, can you unmute all, please, to let them and anyone to introduce himself and you want to ask?
Hello, Dr. Martin. I'm Omar Zaid, a general practitioner at Dr.
Hello.
Hello.
I think there is noise from anyone. Okay. Hello. Um, I think there was noise
Dr.
from
Michel, please, you can start, and anyone will have a question. At the end of the lecture, he will ask you. Okay?
okay, but firstly, I wanted to ask to answer any question first. According to the
Okay, they are ready to listen to you. They are not interested to ask any question.
okay,
Go on, and any question, I will open the mic for them, because I'm a little bit busy, and I will record this for Dr. Ahmed Mansi and Dr. Wala. Okay, so can you start, and at the end of the lecture they can ask.
okay. Thank you, Doctor. Thank you. Okay, firstly, according to the writing task, I think it's the most difficult part in the exam. We have some points to be formulated first. Firstly, according to the layout of the letter, you have to write the address, then after a row, you have to write the date of your exam, or usually the last visit dated by the date of your exam. So don't worry about this. The last visit will be dated by the date of your exam. After a row, you will write dear Dr. X, like this, dear Dr. B. White, okay, or Dr. White, because you will write in the address the full name of the doctor, okay, in the address. So you will use only the surname only. If you don't have the name of the doctor, you will use dear sir slash madam, dear sir slash madam, and write please S and M of sir and madam capital, please, then comma, dear sir slash madam, then comma. Okay, after a row you will write the resection, the name of the patient, the full name of the patient, Mr. XY, or something like this. Okay, then date of birth, if given. If it's not given, it's not necessary to write this, or write any idea about his age, of course. Some people write this RE colon Mr. Brown White, for example, comma, at the same row, without any spaces, comma, 6 years old, 60 years old, okay, but years, because this type of word is a noun, not an adjective, okay? It's not like a 60-year-old accountant or patient. It's an adjective for accountant, and in English we cannot make adjectives plural like this, like Dr. Michel and Dr. Reda are excellence. We cannot say this. We cannot say adjectives as plural. But in this sentence, uh, this word is a noun and can be plural. Okay, but a 60-year-old accountant, this word is a compound adjective. A compound adjective, an adjective consisting of two parts, okay, or three parts, like well-known. Well-known means famous. Well-known is a compound adjective, is an advanced adjective. Okay. After this, you have to write about 4 or 5 paragraphs. Okay. After each paragraph, please don't miss the row, an empty row between them. Okay. It's an advanced style of writing and a formal style of writing, of course. Okay. And then don't miss an important point. Okay. Please write the name of the patient, the name of the patient, the surname, of course, of the patient at the beginning sentence of each paragraph. At the beginning sentence of each paragraph. Please don't miss this. Don't write he or she before at the first sentence of each paragraph. Please, the first sentence of each paragraph must contain the surname of the patient, and don't miss this, please. Okay. According to the first paragraph, generally will contain the cause of referral. Cause of referral. If it's a referral, okay, or cause of writing the letter. Okay, like this. From do we get the cause of writing? Okay, let's see with us, please. Sorry for this. Okay, firstly, you have to have a look on the adversely. Okay, so try this method with me. Firstly, using task only. Firstly, okay, using the information given in the case notes, this grammatical structure called a modifier, but it's not our business now. Write a letter of referral to Dr. B. White, new surgeon, City Hospital, Newtown. Okay, so it's an address. It's the address of our letter. Okay, from this information, you have gotten the level of or the specialty of the doctor we will send the patient to. Okay, neurosurgeon. So it's a neurological patient. Okay, what is the diagnosis of this patient, and what will be the demands or recommendations for this patient? Okay, I think it will be the cause of writing of this letter. Okay, after this, you must see or have a look on the above 2 or 3 rows. 2 or 3 rows. Okay, don't miss this, please. It's my style of writing, my style of preparing my writing, and I think it will very help. It will be very helpful for you. Okay. Is the voice clear now? Is the voice clear, Dr. Reda?
Yes, very good, very good.
Very good. Okay, thank you. Okay, thank you, Doctor. Okay, now we must determine 2 points only. 2 points only: the diagnosis and the recommendations or demands from this specialist. Okay. Firstly, What is the diagnosis of this patient? Low back pain, most probably discogenic with radiculopathy. Okay, it will be the first sentence of our introduction. Okay, it will put this information as in the first sentence of your introduction. Is the diagnosis of this patient? Like I say, thank you for saying this patient who is suffering from, who is presenting with signs and symptoms suggestive of discogenic low back pain. Whose signs and symptoms are suggestive of discogenic low back pain with radiculopathy. Okay. Any structure do you want, but advancedly, but advanced with relative clause, who or whose or something like this. Okay. The second sentence must contain some recommendations or some demands in a polite way. Like some people say, your further assessment and management would be highly appreciated. I think it's very good, but it's not enough because it's a learned sentence. It's a learned sentence, and mostly repeated more than 100 times in each exam, especially in Egypt, of course. And they know this. They know this. So please avoid some learned sentences formulated by some basic OET instructor. Okay, they make their students study some learned sentences, simple sentences, not complex or compound sentence to this. Okay, I will give you now some advanced, uncommonly used, like I would be grateful. I would be grateful if you could. If you could what? If you could, something he mentioned now. Refer to neurosurgeon and request that, some requests, okay, in a polite way because he's a specialist, of course. Request that neurosurgeon order an MRI and provide advice regarding the possibility of surgery. Okay, copy and paste this. Copy and paste this. If you could order an MRI and provide advice regarding the possibility of surgery, or even assess the possibility of surgery in this patient. Okay, this style of writing contains if. In grammar, we call if as a mixed conditional, not zero, first, second, or third. It's mixed conditional. Okay, so it's more advanced than basic if. You have been counted in your school. Okay, so I think if will make you more polite and make your style more advanced, of course. Okay, so I think it's not good to write your further assessment and management would be highly appreciated. Okay, please don't write as anyone. Please write and in an uncommon way, please. Okay. So firstly, in the introduction, to cut the story short, you will write the cause of admission, the cause of writing by the diagnosis of the patient. Secondly, some requests from this specialist, like MRI, provide advice regarding the possibility of surgery, repeat CBC and INR, provide a full neurological assessment, whatever the case. Okay. Secondly, in the second paragraph, you must formulate another important point, which is risk factors for this patient. And I think it will be very organized later to discuss the risk factors of the patient before proceeding for the visits in details. Okay, to discuss the occupation of the patient in this discogenic low back pain is very important. Of course, it's very relevant note, of course, to discuss the chronic diseases. It's very important because he may undergo surgery. So it's very important to mention he is diabetic, hypertension, uh, hyperlipidemic, atrial fibrillation patient. Each of these diseases will be interpreted by the anesthesia. Okay, so it's very important of this. It's very important to discuss or mention the causes of allergy or allergy agents. Okay, he is allergic to some contrast agents. It's very important for neurosurgeon to avoid MRI with contrast, MRI scan with contrast. So it's very important. Okay, so the risk factors of these patients are very important, but please don't write each point, each uh, don't write each point, each detail and irrelevant. Please be minded with the speciality of the doctor you will send the patient to. Okay, don't be like a computer saving anything. No, please be minded to the specialty. For example, if you send a patient for a psychiatrist, okay, psychiatrist will be minded, will be will will take care of some psychiatric symptoms, not common cold, not physiotherapy, not Epstein-Barr virus or something like this. No, he will take care of low mood and high mood, okay, of mania and depressive symptoms. Only obsessive compulsive disorders, delusions, just select psychiatric symptoms. Just select visits of psychiatric symptoms. Okay, so be minded and have the attitude to select the relative data according to the specialty. I think it will be the most useful idea for you, and I will you will remember me at the exam, of course. I hope this, of course. Okay. So the risk factor is very important. Another very advanced tip I will give to you is the grammar. The advanced grammar you may provide in the exam. What about any event occurring in the past and still occurring till the um, present? Okay, till the present. Okay, like chronic diseases, as hypertension. Mr. X is a hypertensive patient. It's very good. It's accurate in grammar, but it's not advanced. Okay, don't miss present perfect, please. Present perfect, please. Present perfect. When you write chronic diseases, like he has had hypertension, because hypertension in this patient occurred in the past and still present in today, in the next weeks, in the next future, and so on. So if you have any event expressing the continuation between the past and present, don't miss the present perfect, please. And don't be confused between events occurring in the past and cannot be recurred, like appendectomy, like lumbar laminectomy, like bilateral hip replacement. Okay, these events occurred in the past and cannot be recurred again. So don't use present perfect when you express these events, of course. So if you have any event occurred in the past, please you can use past simple, but another important point, past simple cannot be used without a time marker. I cannot say I went home. I'm sorry. I went home without a time marker. I went home yesterday. I went home today. I went home at 2 p.m. Therefore, you have in each visit the date of each visit. You cannot say the patient presented complaining of chest pain. Like many people, many exam takers, many OET instructors make their students study this silly and very repeated sentence, very simple sentence, of course. It's very joking, of course. Like this, the patient attended complaining of chest pain. It's very surprising. It's very advanced, very unusual to say this. Of course, it's very joking, yeah. Okay, in an uncommon way, advanced way. You are intelligent enough to do this, and please don't miss the dates. Okay, many people ask me to correct them later, and I have discovered that they have missed the date of some visits. Some people write this on subsequent visit. He returned it back. Okay, it's very bad technique. Okay, it's a very bad technique because if this is a new paragraph, please don't write he at the first sentence. Please write the surname of the patient, please. Okay, don't write on the subsequent visit. Okay, because when did he return? Okay, any English reader, okay, will ask you about the time frame when you use the past perfect. So the past simple. I'm sorry. So please don't miss this point. Don't say or use past simple tense without a time marker. Okay. Please don't miss this. Please. Okay. The third and fourth paragraph in general, the fourth and fifth paragraph will contain the relevant visits, and I will repeat, relevant visits. Please don't write any visits. Don't write all visits. You will miss your time and miss all the grades, of course. Don't miss your time by writing some irrelevant visits. Okay, when you write to a psychiatrist, don't miss your time to write for Epstein-Barr virus or viral infections, common cold, and something like this. Okay, herpes simplex, viral orofacial, or something like this. Okay, it's not useful for you, of course. One of the most important criteria for them to correct your letter is the third criteria established by OET called comprehension of stimulus. Comprehension of stimulus. Okay, don't miss this. Comprehension of stimulus. Comprehension means understanding. Stimulus means case notes. Of course, case notes are the stimulus of your writing. Comprehension of stimulus means that you have written a letter with relevant data, not irrelevant data. So please don't miss this. Okay, relevant visits. You will choose relevant visits of symptoms regarding the specialty of doctor you will send to. Okay, and also be organized when you write the details of each visit, and be more focused on the positive data of the finding, positive data or abnormal data of investigation. Okay, don't miss this. Another very advanced point for you is missing the past perfect. Is missing the past perfect. Okay. What is the past perfect? What is the past perfect? Okay. What is the benefit of past perfect in your writing? Of course. Or what is the difference between past simple past simple, and past perfect. Okay, past simple is like went. Okay, past perfect, had, and past participle. Okay, what is the difference between past simple and past perfect, please? Okay, if we have two events occurring or which occurred in the past, the first one is past perfect and the second one is past simple. When I have asked Dr. Reda today, what did you do, Reda, after waking up today? Okay, he said that I had washed my hands. I'm joking, of course, with Dr. Reda. Washed my hands. After that, I ate cheese because Dr. Reda is a big lover, is a big fan of cheese. I'm just joking, of course. Okay. Any reader will read this, will discriminate between the event, the sequence of these events which occurred in the past. Had washed, firstly, in the past, okay, had firstly in the past, then eating chicken is the second event, okay? What about OET? How we can apply this for OET? It's very important, and it's a big mistake, and it's a big unknown mistake for many people, not to include past perfect in your writing. It's very massive mistake, okay? What about this? He presented in the second visit, okay? He presented because his condition had deteriorated. What about this? Okay, his condition had deteriorated firstly, then he presented. Okay, so don't miss of this. If you have two events occurring in the past, please don't miss or don't use present simple for both events. Okay, please discriminate the sequence between them. Okay, I think it's a big mistake. Include past perfect. Okay. I speak in general, of course. That's many details for psychiatric setting, the discharge letter, how to write discharge letter. A very important style of writing, which will help you. Your voice is not clear. I'm sorry, Dr. Mustafa. I'm sorry. What about the voice now? I'm sorry. What about the voice now?
The voice is clear دكتور ميشيل تمام.
Okay, I'm sorry. I'm sorry, Dr. Mustafa.
لا لا بيرفكت عن المرة اللي فاتت بيرفكت كمل.
Okay, very good. Okay, thank you, sir. Thank you, my pro. Thank you, Dr. Mustafa. Okay, according to the conclusion, my most important advice from your little child or little brother, of course, please don't repeat yourself. Don't repeat yourself. Please don't repeat yourself. Like this. Some people say this. In view of the above, all the Egyptian write this introduction, of course. It's very important point, make you laugh, of course. In view of the above, my provisional diagnosis is angina. Okay. What a shame. You have mentioned this fact in the introduction. Why did you repeat this? Why do you want to repeat yourself? Please, it's a repetitive fact. Don't repeat yourself, please. I would be grateful if you could assess him as appropriate, as you think appropriate. Okay, what a surprise. What a major point you have formulated. You have pointed out now for me. What a joke. What a shame. Why do you repeat yourself? Please, don't repeat yourself, please. Don't repeat yourself. Some people make their students study these fake sentences, and I say fake because the examiner will remove these words from his counting of your words because it's repetitive. And they told you that it's very important to lengthen, to increase the length, to increase the number of words you will write in the exam. But I think it's a fake. It's a fake method. Please don't repeat yourself. Just greet the doctor. Just some greeting, some thanks for him, like this. If you have any queries, I like this style. If you have any queries, please do not hesitate to contact me. Okay, I think it's very familiar for you, but you can make this sentence more advanced, like this. If you have if in grammar, I say, if you have if, you can make this sentence more advanced. If is a very advanced style of writing, of course, but we can give yourself a more advanced, like this. If you have if in a sentence, you can give yourself a more advanced, like this, removing if and replacing it with a modal verb, like should you have any queries, please do not hesitate to contact me. Should you have any queries, please do not hesitate to contact me. It's not a must to use this style, but please don't repeat yourself. Please don't repeat yourself. Then you will say yours sincerely, yours sincerely, comma, then leave a row and write doctor. Don't sign with your name, please. Don't sign with your name. If he give you a name of doctor and say you are Dr. Sally, you will sign by Dr. Sally, the name he mentioned. Okay, but don't write Dr. Mustafa. Has he given you are Dr. Mustafa, these notes? Okay, so why you sign by Dr. Mustafa, by Dr. Michel? Okay, please be minded of these notes. Okay, don't fabricate the notes. Okay, just sign by doctor. Okay, if nurse, sign by registrar nurse, radiographer, sign by radiographer, and so on. It's the main line of writing. I hope I have benefited you today, but actually I wanted to answer some questions of you, if you have, but it's very difficult now because of the noise. I have a suggestion for Dr. Reda. You can unmute person by person and ask me. Okay, we cannot unmute all the members of our chat. Okay, because it causes very clear noise, of course. Okay, if it's applicable for you. Reda, Dr. Omar. Okay, but Dr. Reda is the admin.
Okay, anyone can has any question? Anyone has got any question? Please raise his hand. He will find.
Okay, but unmute one by one.
Okay.
Not unmute. Please, I'm sorry, Doctor.
No problem. I'm okay. like this. Dr. Omar Zaid raised his hand. I now unmuted him. Okay, go on.
Thank you, Dr. Michel, for your explanation. It was more than great. Second, I want to ask about the present perfect continuous. When a patient was, if he had a cough
Yes,
for
I
1
see.
week. Sorry?
Yes, I see. Okay, let me elaborate, please.
Okay.
Elaborate. I have understood you. Okay.
Okay.
Dr. Omar asked about the difference between the present perfect continuous and the present perfect, or the usage of present perfect continuous. Like this,
Yeah.
he has been suffering from. I'm sorry for my bad writing. I'm sorry.
Okay.
He has been suffering from cough. Okay, this means he suffered from cough and he is still suffering from cough. It's very good, but it's illegal to use past perfect, present perfect continuous without a time frame. Okay, so it's very good to say for a week. So okay, so it's correct, of course, it's correct. But the most important disadvantage of this minor tense is the obligatory use of time frame. Like this, when Dr. Omar asked me for what do you do for living, Michel, I will say I have been working as a doctor, but I must say when or from when since 2013. But I can answer him by I have worked as a doctor, okay, without using any time frame, without mentioning if I don't want to disclose this secret 2013, because it's a shame to begin your career by 13. Of course, I'm joking, of course. Okay, is it clear for you?
Okay. Yes, it is clear. Thank you. But I also have a second question, please, if you allow
Okay.
me. Concerning the indirect speech, when I write, he declared that he had a cough for like when it should be for present perfect, but when it's indirect, how should I change the verb?
Okay, very good question. It's a very good question. You must go to the more far tense, like this. If you have past simple, you will go to
Past perfect.
okay. If you have past simple,
Mm-hmm.
okay, like this. I was tired.
Mm-hmm.
If the patient says it, okay, you will say he reported he had been tired, from past simple to past perfect. If you have present perfect, you will go to past perfect also. So I think 99% of cases in our OET cases, especially in referral letters, we will use past perfect, had and past participle after reported that. Okay. On the other hand, if you say he reported, he had suffered. Okay.
Mm-hmm.
He had suffered firstly, then he reported in front of me. So from both views, you will see past perfect is more important, okay, and followed by the reported verb, the verb of reporting, okay. He firstly had suffered or experienced a chest pain, then he reported this in front of me at my clinic, okay. Did you get this?
Okay. Yes. Thank you, Dr. Michel.
Okay, thank you. Okay,
Thank you.
questions? Any more questions? Any other questions?
Okay, Dr. Muhammad.
Hello, Dr. Rida.
Hello,
Hello,
Dr.
sir.
You and Dr. Rida. Okay.
May I ask Dr. Michel, if I say مثلا the patient have an osteoarthritis since مثلا in 2011 and she have been and مثلا become immobile. I rephrase it to she was suffering from osteoarthritis since 2011 and the over past 3 weeks or 3 months pain and immobile had increased. الجملة دي تبقى ايه sentence ايه زي ما انت يعني as you said present and the past or I confused here.
Okay, thank you for your questions. Okay, thank you for your question. Okay, it's very good. It's a very good note. You can say he has had osteoarthritis in the paragraph of risk factors, in the second paragraph. Okay, in the visits, you will say his pain, he reported that his pain had become worse or his symptoms had worsened or his condition had deteriorated. Okay, the same over the last 3 weeks, for example. Okay, these discriminate between the event occurring in the past and still occurring in the future, which is the osteoarthritis, the chronic disease. The second thing is, or the second most important point is the worsening of symptoms over the last 3 weeks only. Okay, this occurred over the last 3 weeks. Okay, so don't miss this. It's a part of a visit, and all visits must be in the past, not at the present. Okay, some people prefer to write the last visit, the visit of today, in the present. Okay, and I'm not against this, but I prefer to use past simple and past perfect for all visits. Okay, spare the present simple, the present simple and present perfect for the risk factors. Okay, because this paragraph, the second paragraph, is for the social history, the facts for the patient: married, smoker, diabetic, hypertension, and so on, chronic diseases, long-term treatment, and so on. Okay, so did you get this? Okay, do you like me to repeat anything again?
Yes, please, if you don't mind.
Again? Okay. You were right. He has had, regarding his medical history, coma, after this stagnant coma, he has had osteoarthritis since 2013. Okay. In the visits, in the paragraph of visits, okay, you were right. He reported that his condition had deteriorated. Or his symptoms had worsened. Over the last 3 weeks. Okay, any questions? Any other questions? Hello, any other questions?
Dr. Michel, if you don't mind, may I ask a
Yes.
further question or illustrate some
Most
point?
welcome.
Okay, you said in each paragraph you must say, hey, Mr. Kaza, Mr. Austin, Mr. Austin. One of video for JOET, he said first it prefer to mention Mr. Kaza In the second, he, or I'm confused for now. Should I go with the style of Mr. Kada, or should I go for he and leave the first paragraph with a Mr.?
Okay, I have collected this data from Victoria University for OET courses. Okay, from Victoria University. I will share this material with us, okay, in the group. But trust me, is it's a grammatical mistake, and it's a very important point for a more formal speech, more formal style of writing. I demand you to do this. Write the name or the surname of each of the patient at the first sentence of each paragraph. Okay, don't miss this. Okay, because it's more formal in writing. I don't know what Mr. J says, but I think it's more accurate.
Excuse me, Dr. Michel. I just if Dr. Mustafa permit me, or if he don't have any further questions, I have a question related. We have many symptoms like nausea, vomiting, abdominal distension, abdominal discomfort. Shall we use between each symptom like this, moreover, furthermore, in addition to, or we can just put a comma for this?
Moreover, furthermore, in addition, are called conjunctive adverbials. Okay, and must be followed by comma and a complete sentence, not just an item. Okay, you can use along with, or together with, okay, or with, or in addition to. Okay. Okay. Is it
Okay,
clear for
Dr.
you?
Michel, thank you. Yes, of course. Thank you very much.
Okay, Dr. Ala, then Dr.
Yes,
Wissam, Dr. Reda, and Dr. Michel with you. Okay.
Okay.
You can ask Dr. Michel in writing with you.
Okay, I'm asking Dr. Michel. Sir, you said you can use I'd be grateful if you could in the introduction. Could you suggest an uncommon sentence for the conclusion? As you said, don't repeat yourself and don't write like in the view of the above, my diagnosis is. If you have any suggestion for uncommon sentence to put in conclusion?
I prefer to use simple sentence for conclusion, just a sentence or two simple sentences without repetition. Like, should you have any queries, please do not hesitate to contact me. Full stop. Thank you for your kind care. In all official samples of OET, they just say it would be appreciated if you pay attention to this patient only. Just one sentence, okay? But don't write some repetition like the provisional diagnosis again, the demands again. Some people prefer to displace the second sentence of the introduction, the recommendation, and put it in the conclusion. Like, I would be grateful if you could arrange for a full neurological assessment. Okay, some people put them in the introduction, and I prefer this. And some people prefer to displace it to the first sentence of conclusion before should you have any queries. Okay, both are correct, but in IELTS, I have been encountered by an idea that the conclusion must contain no new ideas. Okay, it's the formal style of writing. Conclusion is just a summary, but if you write an essay, not a letter. Okay, so it's an optional for you to write the recommendations in the introduction or in the conclusion. Okay, but don't repeat yourself. Okay, don't write in view of the above. My provisional diagnosis, angina. And you have written the same idea in the introduction. Okay?
Yeah, okay. It's clear now. Thank you.
Thank you, sir.
No one has any question again. We have finished. Dr. Omar Zaid has just asked. Dr. Ala Suleiman has just asked. Okay, anyone has any query, please raise his hand because I will now start speaking orientation. Okay. And I will do this quickly and then start doing some speaking role play cards with you. Dr. Ahmed, Dr. Hana, Dr. Khairiyya, Dr. Mustafa Ahmed, Dr. Wissam, Dr. Noor. Anyone has any question before I start? Okay, Dr. Michel, can you please stay with us for any comments, okay?
Okay, with pleasure, sir. With pleasure.
Okay, thank you, Dr. Michel.